ओके, 3 to 1 नहीं आया है। Hi everybody, I'm Dr. Usha Dave over here. I'm a medical geneticist and neuroscientist. I have been working in the field of childhood disabilities for more than 30 years and also a national professor, postgraduate research guide for MSc PhDs of Bombay University, also as a consultant and advisor for several organizations, Government of India, private, as a medical geneticist. Now, why am I here today to talk about the newborn screening test? That is our topic. Okay. So, this is how it is related with childhood disabilities. Fine. So, childhood disabilities are there which may be due to various reasons. But the important what we are going to discuss in relation with newborn screening test are those which are inherited or congenital disorders or metabolic disorder which cause disability or illness in your child. So why we are here is that every parents would definitely think about the safety or a healthy baby, right? And there are certain hidden conditions which are not seen when the baby is born. The baby looks very apparently normal, healthy, as such. But these conditions appear later on at the age of 2 years or 3 years or later 5 or 6 they appear, but they are there hidden. And there are tests which you can do soon after birth, after 3 days or 48 hours, we call it. And it is a way by taking a very simple dried blood spot from the heel prick of a baby, which I will show you also. So these are the disorder which are, then you will ask me, oh, my baby is normal. Why is it that we have to do this? Now, these are worldwide accepted newborn screening tests, which are introduced in the health policies of many countries also, but not so much in India as such, though they are there in a private or, few in the government. And these disorders later, for example, congenital hypothyroidism. Okay. So at birth, you will not see much anything. The baby will appear normal. But later on, there could be the developmental delay or mental or motor deficiency जो बोलते हैं, या बच्चे बोल नहीं सकते हैं, कभी कभी ऑटिस्टिक होते हैं, कभी कभी लर्निंग डिसेबिलिटी होती है, बिहेवियरल प्रॉब्लम होते हैं. सो ऐसी जो बीमारियां होती है जो आनुवंशिक है, so if we detect them soon after birth, you can prevent it. You can do some treatment. In some of them, there is a treatment available. In some of them, there is some diet manipulation can be done. But जो brain damage होता है, that can be prevented. The child can go normally. So these tests are used. So as a parents, we should know about it. And they are available also in the hospital or the private laboratories, government laboratories. Sometimes they are there at the state level. And what we can have to do is just take, if you see over here, is the dried blood spot on a very special filter paper. Okay. This is the special filter paper on which you take it. And it is just the heel prick. If you just see over here, it's just the heel. Okay. So from the baby's heel, from the both sides, if you see over here, the heel prick is done and the blood drops come out, which are taken on this filter paper. So it is not at all cumbersome, dried, the dried filter paper is sent to the laboratory and the results are available within 3 to 5 days. Okay. So there are different types of newborn screening tests, in the sense some have 3 or 4 disorders included. Some have 7 disorders like congenital hypothyroidism, G6PD, cystic fibrosis, biotinidase deficiency. These are the metabolic disorders, what we call, because the baby is not born by birth or inherited. आनुवंशिक दोष होता है जो वो दोनों पेरेंट्स के पास से भी आ सकता है या फर्स्ट टाइम ऑल्सो बेबी में हो सकता है. सो ये जानकारी जो हमको पहले से ही मालूम हो गई, और इफ इट इज पॉजिटिव वी कैन डू समथिंग टू द बेबी, राइट. So we can counsel it. Then if it is positive, then you have to approach again the lab or the doctor. You have to do the confirmatory test for it, and then you can do further management. So around the world, then there are now the mass spectrometry is the high technique which has come. So to include more and more disorders, newborn screening test mein ho gaye. So newborn screening is not just one test, remember. So it is a comprehensive program. So somebody who takes up as such, they also have a knowledge and information that the parents are counseled if they are positive. Sometimes it, like, again you have to as per the protocol because it's a screening test. Okay, तो कभी false positive false negative होता है तो confirmatory diagnostic test उसके बाद 15 दिन के बाद की जाती है. If that is positive, then further counseling is done, okay, to the parent. Okay, how to deal with it, how to prevent, and it is a manageable, okay. So that's why it can be as a, आप यूजुअली स्मॉल पॉक्स वैक्सीन लेते हैं क्योंकि आगे जाके उसको कुछ हो नहीं जाए स्मॉल पॉक्स. तो सिमिलरली ये भी वैसे ही टाइप की न्यूबॉर्न स्क्रीनिंग टेस्ट है जो पहले जो हिडन कंडीशंस होती है मेडिकल या मेटाबॉलिक जेनेटिक डिसऑर्डर्स हम बोलते हैं वो दिखती नहीं है हमको और तभी हमको कुछ ना कुछ करना चाहिए. नाउ ऐसा नहीं आप पूछेंगे मुझे कि ओनली आफ्टर 48 आवर्स नहीं, इवन 15 दिन हो गए, 1 महीने, बट अर्लियर यू डू द बेटर बिकॉज द ब्रेन डैमेज चालू नहीं होना चाहिए. सो अर्लियर यू डू दिस टेस्ट ऑन योर चाइल्ड, come to know and your baby is safe and healthy rather than you are late, you have not done. There are also results and the cases are there abroad who had not done newborn screening that time. It was there in their family and then the baby had become spastic and mentally retarded. So when they went back and found out that this baby was not gone for newborn screening test. So this is about the newborn screening test. So there are hospitals, there are government hospitals. You will find sometimes these tests are offered as a 2D. So it is your choice. If you cannot afford many, then you select a test which covers a larger number of disorders. Sometimes 46 conditions are there. Now these genetic conditions are many, more, but it is not always possible to have all at a time in one newborn screening test. बट दोज विच आर कॉमन, जो कॉमन है, जो बच्चे में अपने पॉपुलेशन में ज्यादा है, जिसका चांस ज्यादा है कि इसमें किसके बारे में अपने को जानकारी होनी चाहिए, तो ऐसी टेस्ट जो है वो कॉमन डिसऑर्डर जिसके वजह से डिसेबिलिटी आती है, मेंटल रिटार्डेशन आता है, स्पास्टिसिटी होती है आगे जाके, तो वैसे डिसऑर्डर एज अ पॉलिसी लेके WHO जो वर्ल्ड हेल्थ ऑर्गेनाइजेशन है, फिर अमेरिकन कॉलेज ऑफ मेडिकल जेनेटिक्स है, ये लोगों ने ऐसे मिला के जो कॉमन है. तो अभी आप पूछोगे अपने पॉपुलेशन में, अपने इंडिया में वी आर फॉलोइंग देयर ओनली दी पॉलिसीज. अपने यहाँ इतना नहीं है कि पॉपुलेशन में जाके हम लोग फाइंड आउट. आर बाय एंड लार्ज आर द मोस्ट कॉमन डिसऑर्डर. ओके, so again if I tell you something about the method, as I told you, there are other methods also on mass spectrometry which we call. So किसी को ऐसे लगता है कि मेरी बेबी को प्रिक नहीं करना चाहिए, तो you can do it from urine also. Okay, so urine can be also filter paper and similarly can be sent, because this you can just send it in the envelope as such and send it. You do not need a courier or ice pack or anything as such. Okay, and can be as a rural level baby, even those where the lab is not there. Even अपने यहाँ इंडिया में जो है villages में रहते हैं, rural में रहते हैं, so every hospital can go and can have and they should have such newborn screening tests in their health policies and programs. Okay. आप पूछोगे कि confirmatory test ही जरूरी है क्या? Yes, always a confirmatory test is required so that, और later on बाद में भी the clinical specialist जो होते हैं ये disorder के बारे में ज्यादा जानते हैं, वो बेबी को आपके मॉनिटर कर सकते हैं, थेरेपी मैनेजमेंट देना. फॉर एग्जांपल congenital hypothyroid is just a thyroid hormone is not there. अभी मैं यहाँ एक एग्जांपल देना चाहती हूँ कि the baby जब भी about it was 20 years back the story, but the baby had come as 2.5 years old with wrinkles, no dentation नहीं आया था, वो बैठ नहीं सकती थी, चल नहीं सकती थी, और वो मम्मी ने उसके जो लाया, वो जो मुस्लिम थे, उसको भी कुछ मालूम नहीं था। वो बोली मैं हम कितने डॉक्टर के यहाँ गए, कुछ नहीं हो रहा है। सो हमने उस पे कंजेनिटल हाइपोथायराइडिज्म जब भी सस्पेक्ट किया, और क्विकली उसका तो वेरी सिंपल है, कंफर्मेटरी किया, आयोडीन चालू किया, ये क्या, विद इन अ मंथ और 2 months उसके रिंकल्स गए, वो बैठने लगी, खड़ी होने लगी, और उसके डेंटेशन, एक दो दांत आने लगे। तो माँ बाप को तो ऐसे लगे अरे क्या हमने एकदम क्या मैजिक किया है, हम एकदम भगवान है। सो नो, इट वाज नॉट दैट। द थिंग वाज, देन वी फाउंड आउट कि मदर को भी है, ये है, मदर को भी ये है, और मदर को ऑल्सो हाइपोथायराइडिज्म था जो डिटेक्ट नहीं हुआ था, उसको ट्रीट किया। तो कभी कभी ये जो फैमिली में होते हैं अपने को मालूम नहीं पड़ता है, but it is required. So in her case, because though we were late, this test should have been done after the baby was newborn. But naturally, अपने यहाँ सभी clinicians not aware, और अभी तो है सब, all clinicians are aware, pediatrician। तो मैं आपको एक सलाह देना चाहती हूँ कि एज सुन एज आपके फैमिली में, आपके कहाँ भी जो क्लोज फैमिली मेंबर्स है, फ्रेंड्स है, उनके यहाँ बेबी पैदा होते हैं, आप डॉक्टर को पूछना चाहिए कि मुझे ये बच्चे पे न्यूबॉर्न स्क्रीनिंग टेस्ट करनी है। दिस टेस्ट इज अवेलेबल, सच टेस्ट इन इंडिया, लेबोरेटरी है, हॉस्पिटल में होते हैं, प्राइवेट है, गवर्नमेंट लेवल पे भी कहाँ कहाँ होते हैं, तो ये करना है। So it is very important कि we ourselves are aware of such tests. Okay, so this is about the newborn screening test. Is there anything, any other questions are there about it? और एक मैं इधर यहाँ ऐड करना चाहूंगी कि these tests are sometimes they are mandatory in USA, Australia, all these developed country में they are compulsory, they are taken care of also and mandatory. So as soon as the baby is, even the parents को या couple जो होते हैं उनको मालूम नहीं होता है कि मेरी बेबी की हिल प्रैक्टिस, इसको हिल प्रैक्टिस बोलते हैं, हिल प्रैक्टिस। सो हिल यानी ये अपनी जो हिल होती है बेबी की, उसके साइड के यहाँ से वो ब्लड प्रिक करके वहां से ब्लड लेते, राइट। तो वो जो ड्रॉप आता है वो स्पेशल फिल्टर पेपर पे आते हैं, ऐसे 3 सर्कल करते हैं, फुल्ली इट इज कवर बोथ साइड्स एंड नाइसली इट इज सो एयर ड्राइड, एंड दिस फिल्टर पेपर with your name, age, date of birth, or any other things है, any other clinical abnormality, और normal healthy baby body weight के साथ लैब में भेजा जाता है। So वहां वो जो कंपल्सरी है, in case it is positive, then only parents know, otherwise they just know कि okay newborn screening test हो गए हैं और मेरी बच्ची भी इसमें निगेटिव है, ठीक है। Now this test once it is positive, अपने फैमिली में है कुछ डिसऑर्डर, तो आप बोलोगे कि क्या क्या ट्रीटमेंट होती है। फॉर एग्जांपल मैंने कंजेनिटल हाइपोथायराइडिज्म तो वेरी सिंपल दिया। नाउ ऑल जेनेटिक डिसऑर्डर्स के लिए थेरेपी के लिए टेस्ट और द थेरेपी है ऐसा नहीं होता है, बट यू कैन प्रिवेंट इट। फॉर एग्जांपल गैलेक्टोजीमिया, ये एक ऐसी शुगर मेटाबॉलिज्म डिसऑर्डर होती है, वो बेबी जो शुगर है गैलेक्टोज वो नहीं उस मेटाबोलाइज कर सकती है ब्रेस्ट मिल्क में और इसमें। लेकिन क्या होता है उसमें, आप क्या, यू कैन चेंज दैट गैलेक्टो, यू कैन हैव सम सोया मिल्क और समथिंग, और देन you can also restrict your that sugar, you can give energy through protein or other substance. So that way जो toxic metabolites होते हैं जिसकी वजह से ब्रेन के ऊपर इलाज, ब्रेन के ऊपर इफेक्ट होता है, and because of that there is a mental retardation. So therefore you can do the diet treatment, you can have also the prevention done. So this is mainly a preventive test. Newborn screening is very, very important to prevent the disease which will happen later on in the baby's life. Okay. So if I go, I think there are some questions about it. Okay, what are hidden disorders or conditions? When I use the term hidden disorders means it is a inborn error of metabolism or congenital genetic disorder, which are that time they are not seen. The baby soon after birth is apparently normal. It looks healthy, it looks normal, maybe 3 months, maybe 6 months. But there is this condition there. So that's why I use the word, they are hidden there. So once you do the test, then you come to know. Okay. Now, second is question is, what is it? How is the screening for critical congenital heart disease done? Yes, the congenital heart disease is now, it is also included some of the people in newborn screening, because see, now when the knowledge is coming up, there is more and more information. And when the clinicians and the people are doing, we find more and more congenital heart diseases. Okay. And there are genetic or DNA defects, the mutation which are known. So now is also you can do the congenital heart disease by the genomic test by taking the blood DNA, and then you can do the CCHD, congenital heart disease. But ultrasonographically, it can be first detected. So therefore, during the fetus time, they know about it. So clinically, you can also correlate. Okay, and that's why as soon as the baby is born, that time a clinician ke saath you can discuss, find out which are the thing and which are the tests to be done. There are some congenital heart diseases which are also there with mitochondrial, जो एक substance होते हैं, organelle होते हैं cell में mitochondria करके nucleus के बाजू में cell site. So sometimes it's a mitochondrial may be attached है. Sometimes these are in congenital storage disorder भी congenital heart defect होते हैं. So there are many different types. So based on the high suspicion, one can do the test. But now there is a genomic technology has come which can screen a wide, so you can do the genomic test. What will be done with my baby's blood sample after all testing is completed? This is very good question. We have to learn from the other countries, developed countries who have already, done such huge program. They store that blood. Those leftover blood samples are stored in the lab only for many years with stack names and all. Occasionally, they are used later on. But at times, the government decides their own policies that after 5 years or 10 years, then you can destroy or cannot be used. Sometimes it is misused, abused, So for such medical legal purposes, it should not be used or should be used. This is the question, and that time the authority or the legal authority comes into picture. But the countries have their own policies, and then you can store it for 5 years, 10 years, mainly maximum. And then if you want, you can discard. That is one of the examples in Australia, Western, when they had a huge program, population screening. How much is the newborn screening test cost? Okay, this depends upon, there are a basic, as per our Indian Council of Medical Research, we had started, I was also there as a technical expert on this pilot project. And India में ये दो disorder के लिए, congenital hypothyroidism and दूसरी congenital adrenal hyperplasia करके disorder होती है, उसके लिए चालू किया था. But now there are 3 to 4 most common disorder. So if it is G6PD biotinase, as I told you. So आपने जो opt किया कि दो disorder के लिए ही मुझे करना है, then it is something like 600, 500 to 600, 200, 250 per. Or if it is 4 or 5, 6, in multiples of that, it will go like 1500 or 2000 for 5, 6. If you go for that mass spectrometry, which could be 2500, 2000 or 15, it covers large 46 disorders. Okay. Sometimes hemoglobinopathy, जो बोलते हैं थैलेसेमिया है, blood disorder है, अपने यहाँ इंडिया में बहुत rampant होता है. So ऐसी जो family में already disorder है, so इसमें जो अलग होता है. So depending on 1 or 2 disorder, it can be from 300-400 रुपए से 1500, 3000 ऐसे भी जा सकते हैं. Which is not much, I feel, because one can have even a pizza, for 1,000 rupees nowadays. So this is important from the prevention of childhood disability, and you are sure that my baby is safe, baby is healthy, and baby doesn't have the disorder. Okay. So the next question is, has come as, are newborn screening conditions rare? Yes, they are rare, but collectively, if you see, 1 in 1500 to 1000, because collectively there are more than 2 to 3000, almost sometimes now the number has gone to genetic conditions very high as 5 to 6000. But if you take these newborn screening tests which are involved, no, though they are rare. If you see our population, or the consanguineous marriage, the blood relation marriages should not be, because blood relation marriages will bring that defect very close in your family, right? So that will reoccur again and again. So if it is like that, then these conditions do not become that much rare. So 1 in 1500, 1 in 2000, generally, collectively we say incidence, but it should not be our baby, okay? That 1 in 1000 baby, which is bad. For example, hypothyroidism and CAH, the incidence is still high, 1 in 800, 1 in 700 and all, in few pockets of populations of India. So though we say rare, but it can be, happening to you or your baby. So we should not miss this opportunity. My ultrasonography during pregnancy were all normal. Does my baby still need a newborn screening test? Yes. Yes, even despite of the having all pregnancy tests normal, because those are for other conditions. They do not come into the congenital, but there could be sometimes some defects are shown. But even if it is a normal pregnancy, still you have to do it, because all these metabolic disorders are not shown there as a ultrasonographically on those first trimester or second trimester tests. Okay. You see here, no? Okay, the next question is like, does the newborn screening test hurt my baby? No, it doesn't hurt your baby at all, because it is a very soft tissue from surrounding, the soft area here. I'll see. Okay, which is on the side of it. So, which is on the side of your heel, okay, and not near the bone which is there. So it is just the prick done, the blood drop oozes out, and that is then your filter paper is attached on it, and then it is soaked and taken. So it doesn't, it definitely with some prick, it may little hurt and the baby may cry, but then it's a healing quickly is done. It happens healing quickly, and one doesn't have to worry about it. Where can I go to find out what condition my state screens for? Sometimes you will have from your health department or government hospital, pediatric or neonatology department, find out whether they are doing a newborn screening test. Otherwise, you can also search, and there are different laboratories who are taking and accepting the samples for doing this test. So health department is the one who does it. For example, the Kerala is the one who had started. Goa was the one who had earlier started, and again it was stopped. Now currently in Mumbai, I'm from Mumbai, so I know in Bombay Municipal Corporation, BMC hospitals also, they have started this newborn screening test for 4 to 5 disorders together. Okay. So you will get this information from neonatology and pediatric department. How should I get my baby's results? Yes, as soon as the baby's result is positive, you are contacted. If it is a negative, the report is given to the doctor. The next question is like, which screening tests are offered? I did not get which screening means. These are called as a newborn screening test. If you are asking about the method or the laboratory test, for different tests, there is a different methods used. Okay. Or when we say as a mass spectrometry, ELISA, or using urine or using dried blood spot. So these are called as the newborn screening test. If you are asking me about which are the screening test means it is done on a very large population, having cost effectiveness, and these disorders are also to be there should be treatment available. You can prevent this disorder. So there are certain criteria laid down for which disorder to be selected. But in our population, we do not know yet which are the common disorder. So how will you do it? So then which are the most common as per the published literature, which can be prevented, which can be treated. The counseling can be done. The other family members can be also taken. They can also take care of this disorder in their family. That can be done. So though newborn screening, why the word use screening? Because these are the fast, high throughput tests, and then therefore these tests are called as a screening. But therefore it has to be confirmed by another test to confirm the diagnosis. While the diagnosis, it is quite possible you will have anxiety, O positive, but it may come out negative also in the next time. Okay. So if it comes out negative, then in that case you are very at peace and not to worry. Okay. Why do some babies need to be retested? Okay, in this thing, why they need to be retested? As I told you, the screening tests are used on the very high, fast, high throughput. So on one side, we want the test in the next day, or within 2 days, the result. And then that time, the screen positive or screen negative is very high in that methodology used. Okay. So that much of the the weightage is given according to the test positive, negative, how much of the percentage is there. So as per the international protocol, we use this as a fast test in a high population, cost effectively, and by using the technologies where there could be false positive, negative. So just to avoid that, we should not escape a single baby who is positive and then it was given also by negative, right? So, or a negative and unnecessary is a positive, the other way. So, international protocol are there, WHO and others. So, every screening test has to be repeated by the confirmatory test and the repeat test also. Repeat test and then confirmatory test. That is the protocol. So, therefore, some babies, and then sometimes it so happens that in our condition, in our climate and weather is such that the blood spot is not properly collected also or sent also, or there may be the temperature and not stored properly, not dried properly, or sometimes it is not there on both sides, the blood is only on one side. So because of so many such reasons, the blood spots can be rejected. If you see over here, you can see, the few spots. So there has to be a training. The training is given to the doctor and nurses. So one has to be very utterly careful while collecting the newborn screening blood drops on the filter paper. Otherwise, there will be from the lab side again asking for the repeat sample. So that's where also you may get the repeat sample request that, okay, the blood was not proper. And that is the reason you have to do in some babies, sometimes the retesting is done. And or if it is positive also, again after 10-15 days, the baby has to be retested. Any other questions which is there? Ayushi? Any other questions are there? So I hope I am clear to everybody. And in case there are any questions, my email ID and my mobile is there available. You can always send me queries about any types of queries. And in case there is already any, any congenital familial disorder in the family or genetic conditions, through this, session, I want to give a message that please do not hesitate, do not hide, do not feel it is a stigma. There could be muscle disorder, neuromuscular disorder, brain disorder, or which you can come out and tell your doctor. There is always sometimes a solution. at least majority of the disorders can be also prevented, and if it is reported, detected properly at the same time. So you should come out and ask. You should make a the query that I want to do the newborn screening test, or if such conditions are already there in your families, you must come out, because now the technology जो है वो इतनी बड़ी इम्प्रूव हो गई है और हाई टेक्नोलॉजी हो गई है कि इवन प्रेग्नेंट विमेन में उसके पेट में से, बाजू में से, बेबी के बाजू में फिटल टिश्यू या फ्लूइड कुछ भी निकाल के सेम डिसऑर्डर नहीं है ना, वो हम लोग चेक कर सकते हैं। तो सिमिलर बेबी इन द फैमिली फिर नहीं आए, इसके लिए अभी बहुत ही टेक्नोलॉजी अवेलेबल है, उपाय अवेलेबल है, और ये टेक्नोलॉजी का फायदा हम लोग उठा सकते हैं। So that I would say as my takeaway message, one should be very aware and conscious about what is happening. These are simple tests, very not expensive also, but newborn screening tests should be just implemented on all our populations, all newborn babies. And if there is something familiar genetic condition, please do come out and share with your doctor, so that something can be done to prevent. Because by preventing, you are reducing such a high burden not only on your family, socio-economic, financial, emotional, but also on the nation. Okay. So to reduce the national burden, newborn screening is the ideal program of preventive health policy. Thank you so much.